Hey team, here today to talk to you about our wonderful facial overlays. For this scenario, we're doing like a basic elder care type scenario. So we've got two elderly faces. Our facial overlays fit wonderfully over the 3G. So we'll just pop one of the faces on so you can see how easy it is to apply them and add some variety to your simulations. So we'll show you just how easy it is to swap between the two different patients here. So we'll just take the Velcro strap off at the back, just making sure we don't pull too firmly on the face, and it just peels right off the top of the head there. So storing them, we just use these fake heads to store our masks on. So again, just using the Velcro at the back and the elastic around the wig really helps with making sure that the mask is seated well. So we'll just tuck the mask around there, Velcro around the back, just making sure that the wig's on correctly. So once the wig and the Velcro are on, means it should line up incredibly well with the mannequin's eyes, so it doesn't normally interfere with the blink mechanics of the mannequins, as well as making sure that this sort of this gorget type area here is well tucked in, just making sure that making sure it seats well on your mannequins, so it won't interfere with things like CPR or any other kind of thing you need to do. So during routine airway management, or when you're trying to bag valve mask a patient, obviously beards can be quite a challenge in that area, particularly for things like anesthetics. So trying to ventilate somebody with a beard can be quite a challenge. Providing positive pressure ventilation when you've got a massive leak around the mask can be really hard work. And this guy is not easy because of his beard. So one of the concerns that people do raise is about whether you end up with a double set of lips on your mannequins. Now, as you can see, if I just brush his moustache out of the way, you can't see the mannequin's lips at all, which is great. It does sometimes mean it can be a little bit more challenging to intubate. However, with a long enough laryngoscope blade, you'll be in the right place. Those challenges are easily overcome with the correct tools. So a lot of time, effort, and energy and passion has gone into creating these fantastic facial overlays for us. All of the hair is individually punched in, all of the facial hair. Obviously, the head hair is all a wig, but down here, all of these individuals' hairs have to be punched in. So please do take care when removing the masks, and do treat them with some respect, and they'll last a really long time for you.
For storing our mannequin overlays, we highly recommend for you to use either our plastic inserts that comes with your mannequin overlay, or have one of these mannequin heads. Storing it in a nice, cool, dark area is ideal. Silicone can end up being a little bit oily over time, so putting a little bit of powder on can help prevent that. Using a hairnet over the wig will make your wig look better in the long run as well. You can brush the hair with normal brushes, combs. You could even wash your mannequin if you would like to, if it's been used a lot. You can wash it in some warm soapy water. Use some little shampoo. You can use that on the wigs. We know our customers do use our overlays for standardized patients as well, so in that case it is nice to be able to clean them really properly. So even spraying a little bit of isopropyl alcohol in the middle of the overlay will make it nice and clean. As all our mannequin facial overlays are handmade and hand punched, so meaning that each individual hair has been punched into the silicone. This is strong but not super strong, so do not pull on any hairs in faces. So, but they're very durable and they will last you a long time to enjoy. Furthermore, our Velcro strap at the back, just be mindful that you always close it, especially with models with longer hair, so that the Velcro doesn't get tangled with your hair. And easy as that, you can store your mannequins like that.
So using the facial overlays is great for many reasons. One, it means you can have a variety of scenarios and a variety of patient appearances. It's great for participant buy-in because you're now no longer dealing with the sort of standard mannequin faces. So it creates that personal aspect to the scenarios, making your participants more involved and more bought into what's happening. Particularly good if you want to represent different peoples and different cultures.